Hello, health champions. Today we're going to talk about the top 10 signs and symptoms of high cholesterol. But quite frankly, there aren't that many real signs and symptoms of high cholesterol. So most of what we'll talk about will be alleged signs and symptoms. And the real challenge ahead of us will be to unlearn and clarify the decades of misinformation on this topic. So this is one video where it's critical that you watch from beginning to end so you understand how it really works. Sign number one is called a xanthoma. That comes from the word xanthos, which means yellow, and oma, which is a tumor or a growth or a swelling. So these are often benign fat tumors. They're just like little lumps that sit under the skin. And you can find them in various places, sometimes around elbows, on the tendons, or on the heel or the knee. And if you get it on the eyelid, then it has a special name called xanthelasma. These can definitely be due to high cholesterol, but it's usually not enough just to have high cholesterol in the blood. We also need to have some impaired fat processing, fat metabolism. So typically triglycerides will be high, and also there will often be some kind of immune involvement, that we have some white blood cells and the body is trying to sequester. It's trying to seal off the fat for some reason. Maybe because there's something in the fat like a toxin or a pathogen that we're trying to close off. But there's a tremendous amount of confusion and misinformation. So here's something I found, and they call it 6 subtle signs of high cholesterol. And the first subtle sign apparently is a heart attack. Subtle, very. And the rest is pretty interesting. It says, as you no doubt know, a cholesterol problem will lead to heart problems. So the first part, as you no doubt know, that says it should be so ingrained in you that you should not have to think about this. And the second part says cholesterol problem. So it's implying that high cholesterol in the blood is a cholesterol problem, and that may or may not be true. Then they say that high blood pressure, diabetes, chest pain or angina, stroke or pain while walking are also signs of high cholesterol. So the problem is they're all over the place with causes and associations, but they also make no distinction between high cholesterol in the blood and high cholesterol in a plaque. And it's right here, as they say, as you no doubt know. We've been told so many times that they're the same thing that you shouldn't think about it. You should just accept this as a truth and be very afraid of cholesterol. So this is what we need to clear up. As it turns out, none of these are signs of high cholesterol. And here's why it's so critical that we understand the difference. Here's from PubMed. It says, medication kill us. It says that prescriptions are the third leading cause of death after heart disease and cancer. And how about this? Half of those who die have taken their medication correctly. The other half are medical error. But think about that. Half of them have done exactly what they're supposed to. It's according to the best known practices in the medical system. But let me put this in perspective. The vast majority of prescription medication are for lifestyle problems. It is blood sugar, high blood pressure, it's metabolic disease, about 80% of it. And these are things that can be prevented. But here's what most people don't think about, that when we treat a symptom, when we suppress a symptom, that symptom happens for a reason. There's something causing that. And when we treat the symptom, then we're ignoring the root cause. And the absolute worst thing I know is when a patient comes in and they say, oh, I have diabetes, but it's controlled by medication. And there is no such thing. They're not handling the root cause. They're just suppressing the body's adaptation to an imbalance, but they're allowing the imbalance to not only go on, but to get worse. And when that imbalance gets worse, now it becomes heart disease and cancer. So if we figured that in, I don't have any numbers, but you can make a really good case for prescriptions being the #1 cause of death if you weigh in the fact that when you treat symptoms, you cause the other diseases. And I don't know the exact word for that, but I think you could call it ignorant or reckless or even criminal. Sign number 2 is called arcus senilis, and this is where we get a yellowish, whitish little ring around the cornea on the outside of the colored portion of the eye. And this is very, very common in the elderly. They believe it's because the blood vessels get a little more permeable, a little leaky, at the same time that as people get older, they also get some impairment of their lipid metabolism. But as you know, if you watch this channel, that's not a normal thing that happens when you get older. That happens because your insulin resistance increases and you're moving toward diabetes, which happens to a majority of the population. The good news is, though, that for most people, this doesn't mean a whole lot in itself. The vision does not become affected, and it doesn't have to mean that you have another serious underlying condition. However, if you see this ring around the cornea and you're under 40 to 45 years old, that could indicate that you have familial hypercholesterolemia, which is a genetic predisposition that runs in families where you can have really, really high cholesterol. And that, again, doesn't mean necessarily anything serious, but it does mean that you need to really understand what's going on with your cholesterol. You need to watch all the markers and understand that if the high cholesterol is there, then you need to control all the other variables as perfectly as possible. And there may be some that I missed, but those are the only 2 signs and symptoms I've come across. So the rest of them are going to be alleged or misunderstood signs and symptoms. So first we need to understand what we're talking about. High cholesterol is the same thing as hypercholesterolemia. That means high cholesterol, a lot of cholesterol particles in the blood, floating around in the blood. And according to Google, which is absolutely correct, high cholesterol in the blood has no symptoms. But right after saying no symptoms, they go on to say can have no symptoms, but people may experience common symptoms such as aortic aneurysm, heart attack, peripheral artery disease, or stroke. And here they fall in the same trap as everyone else. Every video, every article, they don't distinguish between high cholesterol in the blood or in the form of a plaque, as if they were the same thing. So what we're being told over and over and over again is that high cholesterol automatically leads to plaques. But the fact is that just as often you can have high cholesterol with no plaques. So if you have an artery, then we have an artery with a thick wall. And here is the inside lumen of the artery. Here is where the cholesterol and the red blood cells and all the other particles and solutes float around in the bloodstream. And here, this is not a plaque. This does not automatically become a plaque. But if we have the right conditions of inflammation and metabolic disease, now we get an infiltration. If the conditions are bad, now some of these particles get damaged and they get across the inside, the intima of that blood vessel, and they start filling up. But it doesn't just come across. It requires damaged particles, it requires an immune response, and it requires inflammation. Some misunderstood signs are frequent tingling in hands and feet, frequent severe headaches, as well as cold hands and feet. And this was supposedly due to poor circulation due to high cholesterol levels in the blood. And they seem to suggest that if you had enough cholesterol in the bloodstream, this would somehow cause friction and congestion in the bloodstream. And there is no way this can happen. So think about it this way. Most of the blood is red blood cells. And cells are pretty small, but compared to cholesterol particles, they're huge. And this is about 45% of the volume, of the total volume of the blood. So in 100 grams of blood, you're going to have about 45 grams of red blood cell, large particles. Almost half of the total volume are these big particles. And they are 8 micrometers, which again is tiny. It's smaller than a human hair by far. But compared to a cholesterol particle, that would be so small it wouldn't even show up on the screen here in comparison. An LDL particle, for example, is one of the larger particles, is 20 nanometers. So micrometer is a millionth of a meter, nanometer is a billionth. So the red blood cell is about 400 times bigger in diameter, and volume-wise, we're talking about over 60 million times larger. So there's no way that this tiny, tiny particle by itself or even will contribute when there is so many other large particles floating around. It would pretty much be like saying that when we have a traffic jam, it's because the small air molecules are interfering with the movement of the cars. But then they're also suggesting that this poor circulation could be due to plaquing. And is there any truth to that? Well, plaquing can reduce circulation, but it is not going to be causing any of these symptoms. There can be some symptoms we'll come back to, but that's not going to be at rest. At rest, these plaques cannot cause these symptoms. Instead, by far the most common cause of tingling and headaches and cold hands and feet are going to be vasoconstriction, when the blood flow is regulated by stress. When we have stress, we tighten up the blood vessels to pull the blood closer to the core at the expense of the extremities. That's why they get cold. Another reason we get frequent tingling is going to be called neuropathy. And the most common cause by far for neuropathy is going to be metabolic disease, which is due to high blood glucose levels and high insulin levels. They cause swelling, so we don't get the proper circulation and blood flow in the nerves. They also say that if you have high cholesterol in your blood, then you will have plaques on the brain, and these plaques can burst and cause a stroke. So this is incorrect for several reasons. Again, you can have high cholesterol in the blood. That does not necessarily mean that you have plaques. But if they burst, then they don't usually come from the brain. They come from somewhere else, from a blood clot or a plaque that burst somewhere else in the body. Then it travels to the brain and causes a stroke. And when it happens that way, it's called an embolic stroke. An embolism is something that travels from one place to the other, and then once it finds a small blood vessel in the brain, where like a fork in the road where it can't get through, and it blocks it. Now we do have indeed a stroke. But when they're talking about a rupture in the brain, that can happen, but not from cholesterol and not from plaquing. This is when the blood vessel itself bursts and you get a bleed in the brain. And this is called a hemorrhagic stroke. Those are the most severe, and unfortunately they're very often fatal. But the mechanism for that is very different. It is usually from chronically very high blood pressure in combination with a weak blood vessel wall. Very often because they're not straight. If they curve too much, that causes excess friction, and there's also some genetic predisposition to this, but that has really nothing to do with cholesterol. The next one is pain when walking, or pain with exertion. And there's some validity to this, but not the way it's typically explained. So high cholesterol, meaning floating in the blood, cannot cause this type of pain. What they're talking about here is when circulation is blocked by a large plaque. And you can have these in your femoral artery or in various different large arteries in the legs. And now if the blood can't get through when you have an exertion, when you try to pump a lot of blood out there, now the muscle doesn't get the supply of oxygen and fuel that it needs. And this is called claudication. And the one caused by plaques is called vascular claudication. So if you're out walking and you're not getting the blood flow, very often you'll have a pain in the calf or in the thigh, and it's kind of a cramping pain where the muscle hurts. And the technical name for this is peripheral artery disease, or PAD, when you have large blood vessels blocked by plaques, where you don't have the opening as large as it should be. And then there's one other type of claudication, though, that has nothing to do with plaques, and that's called neurological claudication. And this is when you have a narrowing of your spinal cord, when the bone has grown inward and it starts encroaching on the spinal cord. Now you can get the same type of pain, but it's not because the blood isn't going there, it's because the nerve signal isn't going there. And when this situation happens in the heart, now it's called angina. It's essentially the exact same thing, except it doesn't happen for neurological reasons because there's no impingement that will affect the heart that way. But the same thing holds true, that it's not the cholesterol in the bloodstream, it's if we have some condition, some inflammation and some disease that causes plaquing. Now with exertion, we're going to get that type of pain in the heart. And if you have angina, there's a natural product from Standard Process called Cataplex E2. Not just the regular vitamin E, but the E2 portion together with some synergists that can act as a vasodilator and help that circulation in the heart and reduce the intensity of those angina attacks. I'll put a link down below if you need that. Alleged symptom number 9 is sore hands and feet. They're saying that joint pain in hands and feet can be caused by high cholesterol, which is not true. There's no way that cholesterol floating around in the blood can cause this. And furthermore, there's no way that plaquing can cause this either. Instead, what we're talking about is inflammation. A lot of osteoarthritis is caused by a low-grade inflammation that is caused by the metabolic disease that we've talked about that also causes the plaquing. And this, of course, is caused by insulin resistance or type 2 diabetes. And a lot of people who have type 2 diabetes and joint pain, whether it's hands and feet or even knees, they find that when they reverse their insulin resistance, the symptoms of joint pain go down or go away. Let me expand a little bit on that because it's never about the cholesterol itself. Like we mentioned previously, you could have high cholesterol and you could have plaques, or you could have high cholesterol and have no plaques. It's kind of like you're saying that some criminals drive a Mercedes. Therefore, people who drive Mercedes are criminals. Like, we cannot make that conclusion. We cannot draw that conclusion. Some people have cholesterol, have plaques, and some don't, right? So before we accuse someone of being a criminal, we want to try to find some incriminating acts. And here is what those are when it comes to plaque. So instead of measuring just cholesterol, we want to measure LDL size. We also want to measure insulin. We want to look at glucose. And we want to measure triglycerides. Now, there's more than these, but this is just a really good example. So what you're going to find, if people have plaques, they will have a reduction in LDL size, they'll have an increase in insulin, an increase in glucose, and an increase in triglycerides. So they could have high cholesterol, and if they also have this, they probably have plaques. But if they have high cholesterol and instead they have a large LDL size and a low level of insulin and low glucose and low triglycerides, then they probably don't have any plaque. There's very unlikely that they do. So measuring cholesterol itself, it's sort of like a 50-50 that they will or they won't. Whereas if we measure the plaque, we'll probably find a better than 90% correlation if we look at the LDL size, if they also have small LDL, high insulin, high glucose, high triglycerides. And the same is true on the reverse. it is probably less than 10%. So if we're talking about the incriminating factors, before we jump to conclusions, why don't we measure the stuff that actually matters? And number 10 is blood tests. This is the only true sign of high cholesterol. It's when you run a blood test and actually measure it. But you cannot get much information from a standard blood test. If all you do is measure total cholesterol and LDL cholesterol and HDL, it's better than nothing, but you're really not learning much. You want to get some additional markers that will tell you about your metabolic health, because it's poor metabolic health that will take the cholesterol from the bloodstream and turn it into plaques. So what you really want to find out is how insulin resistant are you, and you need to measure insulin as well as some other markers for that. You need to measure your LDL size, because that is a very good measure of your degree of inflammation and how much damage you have actually going on. Another one you want to measure is homocysteine, which may be the strongest individual risk factor for heart disease after LDL size and insulin resistance. So if you get a handful of the right markers and you understand what they mean, now you can take control of your metabolic situation. You can understand where you are and what steps to take. And most importantly, you can stop taking the wrong action. And there is a time and a place for medication, but you don't want to get on medication for the wrong reasons. And this is why I've created my blood work course for those who are interested in learning more. If you enjoyed this video, you're going to love that one. And if you truly want to master health by understanding how the body really works, make sure you subscribe, hit that bell, and turn on all the notifications so you never miss a life-saving video.